Hello and welcome to this training video on the Mental Health Act 1983, specifically about Section 5.2 of the Mental Health Act, also known as doctors' holding powers. So we're going to look at a brief overview of the Mental Health Act, and then we're going to look specifically at Section 5.2 of the Mental Health Act and go into some detail about making sure paperwork's being completed correctly and the right way to fill the paperwork out. Then we'll talk a bit about the Section 5.2 process and have a brief look at Section 2 and Section 3 of the Mental Health Act, which we most commonly see here on MAU or on other wards in the hospital, just so hopefully I can answer some of your questions that you might have about it. So, the Mental Health Act, as you can see, a legal framework that provides the authority to detain and treat people who have a mental illness and need protection for their own health and safety or the safety of others. Here's some information about the development of the Mental Health Act over history, which you may or may not find interesting. The Mental Health Act originates from what was known as the Madhouses Act in 1774. This was created to give rights of access to what were then known as madhouses, where people who were deemed to be insane or suffering from lunacy were kept in a confined residency. Sometimes you could be held in these places even if you were not insane, but you were deemed to be by others. The Act outlined regulations due to their misuse, and penalties were set in place for overcrowding, and they were subject to regular inspections. Gradually throughout time, it became the Mental Health Act, which we know and use today. So I just wanted to touch quickly on the relationship to the Mental Capacity Act, because this can cause a lot of confusion for healthcare professionals. So the Mental Health Act and the Mental Capacity Act are obviously separate laws. They do cross paths and they can apply to the same patient at times. But generally, where a person is suffering from a mental illness which they require treatment for, the Mental Health Act is preferable. So the threshold for the Mental Health Act states they must have a disorder or disability of the mind where they are either unable or unwilling to consent to treatment. Whereas the Mental Capacity Act would be triggered by a person lacking capacity to make decisions about their health and their welfare, so it might not even be related to their physical health. So, and also, just because somebody is under the Mental Health Act doesn't mean they actually lack capacity. So many patients can have capacity and still be detained under the Mental Health Act. So there are challenges that come up when we use the Mental Health Act in clinical practice. It could be a really disempowering and frightening and stressful situation and experience for the patient to go through, which is understandable, and we have to remember that we are taking away somebody's right to freedom and right to liberty, and in no way should we be using this as some form of, if you do not do this you will be sectioned. We should always be empowering our patients to work with us and make the right decisions for their care. So in 2018 there was an independent review into the Mental Health Act, and the outcomes were that actually it was being used a lot more frequently than perhaps necessary. Higher rates of detention amongst those from ethnic minority groups, and also there's definitely been, under its use, there's been an abuse of people's human rights. I think with this sometimes people forget that there are other ways for us to encourage patients to comply to the treatment that we're suggesting to them. And because we have the Mental Health Act to fall back on, sometimes we forget how to be resourceful and creative in our engagement with patients. Today we're just going to look more specifically at the doctor's holding powers, or Section 5.2 of the Mental Health Act, because this is something that we can utilise in clinical practice in a general hospital. And this is only for doctors, not psychiatrists, and it has to be somebody higher than an F1 grade. There is a separate act called Section 5.4, which only mental health nurses can use. That's not really something that we're going to be seeing in the general hospital. But the registered nurses on the ward are having separate training on completion of the relevant paperwork that they might come into contact with. So this is a very wordy definition of section 5.2, doctors holding powers. I don't want to stress too much over the wording, but in summary, a doctor may hold a patient against their will in hospital for up to 72 hours should they deem them to be suffering from a mental health problem and are at risk to themselves or others. And this is something we're going to be using as a last resort for our patients when we really have tried all other ways possible to get them to stay. And the purpose of holding them in hospital for up to 72 hours means that this is a temporary section. You're basically saying that you think this patient needs a formal assessment under the Mental Health Act to see if they need to be sectioned for a more longer term period. So this might be an example of how a section 5.2 might be initiated. So let's say that a patient is attempting to leave the ward and it's felt that they suffer with a mental health issue and they are at risk of harming themselves or others. The team have made all attempts possible to try and encourage the patient to stay. Now, usually, in most cases, it's going to be a nurse who's going to be out on the ward who then thinks, actually, this patient is at risk of leaving. We need to look at using a section 5.2. And they might then come and find you and explain what's going on. But it's really important in this case that as doctors, you at least attempt to examine the patient or at least clap eyes on them. And then, if you feel it's appropriate, the section 5.2 form is completed by you guys. And then once you've completed the form, you need to hand this to a registered nurse, as they'll be responsible for completing the other side of it, which is part 2 of the form. So this is an example of a section 5.2 form, also known as a form H1. These can be found in the admin office on MAU in my silver folder full of all Mental Health Act related things. It's also in the cupboard that has all blank forms for patient records near the doctor's office. So this is part 1. So try not to be put off too much by the wording, because it does sound a bit bizarre. To the managers of name and address of hospital, you're just putting there the Royal Derby Hospital. I wouldn't put medical assessment unit necessarily, not needed. You can just put the Royal Derby Hospital. It's really important that you're putting the postcode. A lot of times this isn't completed, and this actually means that it's not actually valid when we don't put the postcode. So I am Dr. and then whoever you are, and you print your full name. And you're completing part B, so a registered medical practitioner, and you're deleting the phrase that's not appropriate. In charge of treatment of the patient's name, who is an inpatient in this hospital and not at present liable to be detained under the Mental Health Act, but it appears to me that an application ought to be made under Part 2 of the Act and for the patient's admission to hospital to be made for the following reasons. And so here you need to give all the reasons why informal or voluntary treatment is no longer appropriate. This is an example. So the patient has a diagnosis of emotionally unstable personality disorder. They've taken a mixed OD with intent to end their life, and they're refusing to stay in hospital, removing their cannula, clearly not consenting to treatment, and they're actually verbalising plans that they want to go and harm themselves after they leave the hospital. So this would be an appropriate situation to use a section 5.2. And then on the other side is part 2, which the nurses need to complete. And until that nurse has signed that side and written the time that you gave them the form, the 72 hours hasn't even started yet. So, you know, technically the patient would be free to leave, and we wouldn't have any means of being able to keep them here. Just quickly on the top part of this, the other side of the 5.2 form, just wanted to say it's really important to put the time in 24-hour format. This does make a huge difference. So as you can see, you then hand it to the nurse and they complete part 2. And then once that's all completed correctly, the clock starts, the 72 hours begins. So what happens next? Usually the ward would then ring the mental health liaison team and tell them that you've put somebody on a section 5.2, give them the details of this, because that means that they can then help you in contacting the AMP team, also known as the Approved Mental Health Practitioner team. And these people are usually, in most cases, social workers that have done extra training on the Mental Health Act. And they can then arrange a team of, in most cases, again, 2 consultant psychiatrists or just psychiatrists that have done the training to be what's called Section 12 approved. And the Mental Health Act assessment will take place within those 72 hours. It would be really unusual for the patient to wait a full 72 hours, and I would say that this is quite bad practice. Usually they have some targets that they need to be there within 10 hours or something, but we do have to bear in mind that they do have to undertake assessments all over the county, and you know, this could be going into people's homes, it might be going to custody, it might be going to psychiatric hospitals. And I will say that sometimes when a patient's already in hospital, they do prioritise people that are in home and not in perhaps somewhere that's safer. So the assessment will then see if the patient requires admission to a hospital, and sometimes a patient may have an assessment and they actually agree to go in voluntarily. So just really quickly, just because some people do ask me this, Section 2 of the Mental Health Act allows a patient to be detained in hospital for up to 28 days, usually for an assessment of their mental health. So you would usually see this for patients who we don't really know much about their mental health. They've not been admitted or sectioned before. We need to get more of an assessment of their diagnosis. Section 3 of the Mental Health Act allows a patient to be detained in hospital for treatment for up to 6 months. That can be renewed, and this would really be used for somebody who we know their diagnosis, we know about their symptoms, we know what treatment works, or perhaps we need to play around with some treatment. And you know, it would be really unusual for somebody who's been on a 3 before to then be put back on a 2. Although I have seen it done, but it's not really, again, it's not best practice. And then also, just to note, there's Section 136, which we might come across on MAU. Normally you're going to see that in ED. So Section 136 allows police to bring a person who is deemed to be mentally disordered in a public place to a place of safety, such as ED. And this lasts for 24 hours. Again, that's allowing time for a Mental Health Act assessment to take place. So just to summarise on some best practice pointers, I would suggest that, again, like I said, you personally examine the patient, not just from the nurse's word. So try and clap eyes on them. Complete the address with the postcode. Make sure you're handing the paperwork physically to a nurse, not just putting it back in the notes, because believe me, it will get missed. And then ensure that you've got some communication with the nurse about who's going to contact the liaison team. You can actually contact the AMP team directly yourself, but I know that this causes confusion, but the details are in the mental health folder. I do know of some occasions where people have actually been required to do this themselves, so I've put it all in the mental health folder. But generally, you know, if you can have communication with the nurse about who's going to do that, because I have come on shift a couple of times and somebody said, oh, there's somebody on a 5-2, and then when I've contacted the AMP team, they've said they've not been aware of it. So unless we notify them, they're certainly not going to know this. And you can always speak to myself, obviously when I'm on duty, or the mental health liaison team for advice and queries. Thank you very much for watching.